In this video, we will be reviewing a detailed description on how to set up and complete caregiver holding for a patient with HIE while cooling. For Phase 1, this will include patients who are not intubated, without seizure activity, and deemed medically stable by the medical team. The hypothermia protocol should be initiated for 24 hours prior to the patient being held by the caregiver. First, the room should be set up and prepared before the holding is initiated. During this time, you can encourage the caregiver to go to the restroom or stretch prior to holding. It is required to have 2 staff members present for the holding to occur. The tracking sheet for documentation of temperatures and additional data will need to be at bedside. You'll need a comfortable supportive chair, preferably with an elevated leg rest, for the caregiver to sit in for 1 hour, as well as 2 pillows to aid in positioning. Have 3 blue clips ready for positioning of respiratory support if in use, EEG leads, and bags, and blue tape for securing the lines. Once all supplies are ready, you can proceed with the following steps for transferring. Assess securement of the patient's lines, including umbilical lines, PIC, or PIV. Ensure tubing and monitor leads are not tangled and that all lines are visible. Position comfortable chair for caregiver next to bed and lower isolate to level of chair. Ensure the video EEG lead cables and bag, central line tubing, and respiratory support, if in use, has enough length to reach the caregiver chair. You may need extension tubing for respiratory support. It is imperative that prior to transfer, you document the infant's vital signs, esophageal temperature, and Arctic sun temperature. Nest transfer infant on cooling blanket and the isolate mattress with all lines, cables, and leads secured to the mattress. You may utilize the blue clips to secure the EEG leads and bag, as well as respiratory tubing if needed. Nest should be placed on parent's lap. Infant to remain in direct contact with cooling blanket at all times, and at no time should infant be skin to skin during holding, and no swaddle devices should be used. Use nurse login provided by EEG staff to reposition camera. Never physically move the EEG cart or camera. Continuous monitoring of vital signs, temperature via esophageal probe, and Arctic sun temperature and output should be maintained throughout holding. These should be tracked every 15 minutes during holding and documented on the tracking sheet. If concerned that therapeutic hypothermia is not being maintained or vital signs of patient become unstable, holding sessions should be discontinued. No padding or bouncing can be provided, as this can alter EEG reading. If concerned for EEG lead dislodgement, call EEG tech to check recording. The goal duration of holding should be 1 hour per day. After 1 hour of holding, ensure all lines and tubing cables are secure for transfer. Staff members will nest transfer back to isolate. Obtain final tracking of vital signs, temperature from esophageal temperature probe, and Arctic sun temperature. Realign video EEG camera onto patient with use of nurse login provided by EEG staff. Again, never physically move the EEG cart or camera. Collect caregiver comments on tracking sheet. Tracking sheet should remain at bedside until patient is rewarmed. Then provide tracking sheet to member of the neuro-NICU team.